I found out I was HIV positive when I was 27 years old. I'm pretty sure I'd contracted it a few months earlier at 26. So when I sit here on my 59th birthday, realizing that I have now lived with HIV longer than I didn't have HIV, it is pretty profound. When at 27 I was diagnosed with HIV, I was terrified. And at that time, one had to wait 2 weeks to get results. So the agony of waiting 2 weeks to get results, and then learning that in fact I was positive. In 1989, 1990, you were also told that you probably had about 18 to 24 months to live. So there I was, 27 years old, a child really, saddled with this death sentence. And my life was just racked with fear, with guilt, shame. And I stayed in denial for a really long time. A few of my friends knew. My mother, who was a really smart woman who read a newspaper every day from cover to cover, asked me 3 times, and I lied 3 times. I decided I needed to tell my family. And my mother and I were arriving the same day at my sister's house. And I decided I was going to tell the 2 of them because I wanted their love. And my mother had said to me, okay, you keep saying no to me, but I'm your mother. Something's not right. And I would want to be there for you. I would want to be with you. So I did tell them, but the way I said it was, I'm sick. And my sister, who was such a lovely, lovely human being, just immediately was showering love on me. My mother stayed seated. And she looked at me and she said, you're sick. What do you mean you're sick? She said, you have the virus? And I said, yes. And she said, have you had pneumocystis? And I said, no. And she starts this litany of opportunistic infections. And I'm like, how does she know this? So she just pounded me with these questions. She said, you're not sick. We come from a family of fighters. And if you let this kill you, I will be very disappointed with you. Not the answer I was expecting, but it was the message I needed in the moment. Why do I tell you that story? I tell you that story because I do hope we can expand opportunities. We can eradicate some of the stigma. If not all, can we just get rid of some of it so that people can go to their loved ones, their most cherished loved ones, and be accepted and be embraced and be able to live healthy lives, loved and held by the people where they come from. Were we sitting here in a room filled with Black people, and I said, what goes on in this house, they would all in unison say, stays in this house. It is what we're taught from the day we're born. We do not share our business in the streets. We do not share our business with anyone. And sometimes we don't even share our business with our own relatives who don't live in this house. It stems from slavery, where telling your business could get you killed, hung. And that legacy, the trauma of it, exists right now in 2021 and will continue to exist in 2121. So then having a situation where there's a sexually contracted or drug-related contracted disease, the shame of that, it's rare that you will find Black people who are willing to talk about that. A person who's Black in the United States of America has a greater likelihood of facing any number of disparities. I think the fact that Black people have to walk around guarded every day against racism plays a role in people not wanting to have to deal with one more thing, not wanting to have to acknowledge one more thing, not wanting to feel discriminated in another way. And as a person living with HIV myself, a Black man, Black gay man living with HIV, I know what a burden it can be. I'm pretty certain that the majority of Black people live in Black communities, all Black communities. Certainly it's so in Chicago, it's so in New York, certainly it's so in Boston. And so even in those communities where there wonderful health care across those cities, those major cities in our country, most Black people still stay in their neighborhoods and get their care in their neighborhoods. And so if this stigma and discrimination exist in those communities, then it makes sense that people are fearful to go into places where they may indeed have a neighbor working or a nurse who is a member of their church, a doc who is their neighbor. We're now in a situation where a person who contracts HIV, who's diagnosed early, gets into care and gets on treatment, can live a long quality life. It rips my heart out to think that people are fearful to get care and to be able to live a healthy life because of the very real fears of being discriminated against, of being dismissed, of being disrespected, being disregarded. When we think about activism in the Black community, I think it's always existed among a few people who had courage and felt they could step out and raise their voices and demand better. But very few. For the longest time, I feel like the sole voice on a national level was Phil Wilson, the founder of the Black AIDS Institute. But Phil was standing out and standing up for Black people even before he founded the Institute. The Institute was a result of that activism. And he was out there doing it, being openly gay, Black and openly gay, long before a lot of people. I think HIV activists are among the fiercest because they are people who have dealt with their own internal homophobia, have dealt with their own internalized HIV stigma, and said, hell no, I'm not going to be reduced to less than a human being. So I think, yeah, combine that with being Black and having dealt with and decided that one is also not going to be dehumanized for race, you get yourself a pretty powerful activist who's not afraid of anyone or anything and willing to take on all the systems that need to be taken on